If you ate a light dinner, skipped dessert, went to bed feeling careful, and still woke up with high blood sugar, please do not blame yourself too quickly. The real cause may not have been your dinner at all. It may have happened while you were asleep, in your liver, your hormones, your medication timing, or even a hidden overnight low. And if you guess the cause wrong, you may make tonight more dangerous. Hello, I'm Dr. Claire Bennett. Today, I want to help you understand why morning blood sugar can be high even after a small dinner, which clues matter most, and the simple 7-day method that can help you stop guessing. Stay with me until the end, because the same high number in the morning can come from very different overnight patterns, and each pattern needs a different response. This matters because many older adults respond to a high morning number by eating less and less at night. Some skip dinner, some skip breakfast, some become afraid of food. And some quietly wonder whether they should change their medication without calling anyone. I do not want that for you. I want you to understand the pattern before you change the plan. This is one of the most frustrating things I hear from older adults. A patient will tell me, "Doctor, I barely ate last night. I had soup, a little toast, no sweets, no late snack, and still my morning sugar was high." When that happens once, it is annoying. When it happens again and again, it can feel unfair. It can make you think your body is broken, or that every food choice you make is wrong. But morning blood sugar is not simply a report card on dinner. It is more like a report from the whole night. While you are sleeping, your liver is still active, your hormones are still changing, your medication is still rising, fading, or wearing off, and your body is still reacting to pain, stress, dehydration, poor sleep, or even an infection you may not have noticed yet. So the better question is not, what did I do wrong last night? The better question is, what pattern is my body showing me overnight? Once you ask that question, the morning number becomes less frightening. It becomes a clue. Let's begin with the most common reason many people wake up high, the dawn phenomenon. This happens in the early morning hours, often before you open your eyes. Your body begins preparing you for the day by releasing what I call wake-up hormones, including cortisol and glucagon. These hormones help you become more alert, and they tell the liver to release stored glucose into the blood, almost like giving you fuel before the day begins. For someone without diabetes, this usually happens quietly. The liver releases some glucose, insulin responds, and the blood sugar stays within a steady range. But if you have type 2 diabetes, prediabetes, or insulin resistance, your body may not respond to insulin as smoothly. The liver releases glucose, but the glucose stays in the bloodstream longer than it should. That means you can wake up with a high number, even though you have not eaten for 10 or 12 hours. A simple way to picture this is to imagine your liver as a storage pantry. During the night, it keeps sugar stored away, but early in the morning, your body says, "The day is starting, send out some fuel." That signal is normal. The trouble begins when your body sends out the fuel, but insulin cannot move that fuel into the cells efficiently. The sugar stays in the blood, and the meter shows a high reading. This is why a light dinner does not always fix a high morning number. If the main driver is the dawn phenomenon, the issue is not necessarily that you ate too much. The issue may be that your liver is releasing glucose early in the morning, and your body cannot handle that glucose smoothly. Now, this leads us to the second important possibility, medication timing. Some diabetes medications are strongest at certain times, and some gradually wear off. If you use insulin, especially long-acting insulin, or if you take evening diabetes medication, the timing and duration can matter. Sometimes the medication does not cover the early morning hours well enough, and blood sugar begins to climb before breakfast. But this is where I want to be very careful. A high morning number does not mean you should increase your medication on your own. Older adults can be more sensitive to medication changes. Kidney function may be different than it was years ago. Appetite may vary from day to day. Activity may change. One dose that seems helpful on Monday may push you too low on Wednesday. So instead of guessing, we look for a pattern. If this is happening to you, write down your bedtime blood sugar, your morning blood sugar, what time you took your medication, what you ate for dinner, whether you moved after dinner, and how well you slept. That small record can be far more helpful than one isolated number. One high number says, something happened. A pattern says, this is when it happens, and this may be why. There is another reason morning blood sugar can be high, and this one surprises many people. Sometimes eating too little at dinner can make the overnight pattern more unstable, especially if you take insulin or certain diabetes pills that can lower blood sugar. These are medications that can sometimes push blood sugar too low, especially overnight, if the food, dose, timing, and activity level do not match well. If your dinner is very small, but your medication is still active, your blood sugar may drop too low while you are asleep. Some people wake up during a low. They may feel shaky, sweaty, anxious, hungry, or as if their heart is pounding. But many older adults do not fully wake up. They may only notice restless sleep, nightmares, damp pajamas, a morning headache, or unusual weakness when they get out of bed. When the body senses low blood sugar, it tries to protect you. It releases stress hormones that tell the liver to push sugar into the bloodstream. Sometimes that protective rebound can go too far, and by morning, the number is high. The practical lesson is very important. A high number in the morning does not always mean your sugar was high all night. It may have been low at 2 or 3 in the morning and then high by wake-up. That is why guessing can be risky. If you see a high number and assume, I need more medication at night, but the real problem was a nighttime low, increasing medication could make the night more dangerous. This matters especially for seniors who live alone, have kidney disease, have memory changes, or take insulin or medications such as glyburide, glipizide, or glyclazide. You do not need to memorize those names. The important point is this: some diabetes medicines can cause lows, and lows during sleep can be easy to miss. As you listen, quietly think about your own pattern, and if you feel comfortable, share it in the comments. Does your morning sugar tend to be higher after a very small dinner, after poor sleep, after a late meal, or after a stressful day? Your experience may help another older adult realize they are not alone, and it may remind them to bring better questions to their next appointment. Now let's talk about the dinner itself, because light does not always mean steady for blood sugar. Many people tell me, I only ate a little, but when we look closely, the meal was mostly fast carbohydrate. It might be tea and toast, a small bowl of white rice, a banana, a few crackers, a little cereal, a small bowl of noodles, or a muffin because cooking felt like too much effort that night. That kind of dinner may look small, but it can still break down quickly into glucose. If there is not enough protein, fiber, or healthy fat to slow digestion, the blood sugar can rise and fall in a less stable way. For some people, the number may rise earlier in the night. For others, the pattern may feel unpredictable. There is also the opposite situation. A dinner can look small, but be rich or fatty, such as fried food, creamy sauce, processed meat, or a dessert that is just a few bites but very dense. Fat can slow stomach emptying, and in some people with diabetes, digestion may already be slower. That means glucose can appear in the bloodstream later than expected, sometimes affecting the overnight or early morning reading. This is why I do not like telling older adults to simply eat less. Eating less is not the same as eating better for blood sugar. And for seniors, eating too little can create other problems, such as loss of muscle, weakness, more hunger later, dizziness, and a higher risk of falls. I would rather help you eat in a steadier way than make you afraid of food. A steadier dinner usually has 3 parts. It has some protein, such as eggs, fish, chicken, tofu, Greek yogurt, lentils, beans, or cottage cheese if you tolerate it. It has fiber-rich vegetables such as spinach, cabbage, broccoli, zucchini, peppers, carrots, or salad. And if you include carbohydrate, it is usually better when the portion is moderate and slower digesting, such as beans, lentils, barley, oats, sweet potato, or a smaller portion of whole grain. For example, a light but steadier dinner might be vegetable soup with lentils and chicken, plus a small slice of whole grain toast. It might be scrambled eggs with spinach and mushrooms, plus half a small sweet potato. It might be tofu with vegetables and a smaller portion of brown rice. It might be plain Greek yogurt with chia seeds and berries if you need something very simple. The goal is not to starve your body at night. The goal is to help your body land gently into sleep. Another cause that often gets missed is dehydration. Many older adults drink less in the evening because they do not want to wake up several times to urinate. That is understandable. No one wants to spend half the night walking back and forth to the bathroom. But if you go to bed already a little dehydrated, your morning reading may look higher because there is less fluid in the bloodstream. Dehydration can also act like a stress on the body, and stress hormones can push glucose upward. This does not mean you should drink a large amount of water right before bed. That may only disturb your sleep and increase bathroom trips. A better approach is to look at your whole day. Are you drinking enough in the morning and afternoon? Is your urine very dark by late day? Are you taking a water pill? Have you been sweating more? Did you have diarrhea, vomiting, fever, or more coffee than usual? For many people, the safer strategy is to drink more consistently earlier in the day, then taper fluids closer to bedtime. But if you have heart failure, kidney disease, or a fluid restriction, follow your medical plan and ask your clinician what amount is safe for you. Sleep quality is another major piece of this puzzle. A poor night can raise morning blood sugar, even when dinner was careful. When you sleep badly, your body often releases more stress hormones. Pain can do the same thing. So can anxiety, grief, inflammation, or illness. This is why two identical dinners can lead to two very different morning readings. One sleep problem I especially want older adults to know about is sleep apnea. Sleep apnea means breathing repeatedly pauses or becomes shallow during sleep. The person may snore loudly, gasp, choke, wake with a dry mouth, wake with morning headaches, or feel exhausted even after spending enough hours in bed. Sleep apnea is not just a snoring problem. It creates repeated stress signals through the night, and those stress signals can worsen insulin resistance. So, if your morning glucose is stubbornly high and you also snore, wake tired, or your partner says you sometimes stop breathing, that is worth discussing with your healthcare provider. The next thing to consider is illness or inflammation. If your morning blood sugar suddenly becomes higher for several days and your routine has not changed, ask yourself what else may be happening in your body. A urinary tract infection, chest infection, dental infection, new pain, arthritis flare, a recent fall, poor sleep, or emotional stress can all raise glucose. Some medications can also raise blood sugar. Steroid medications such as prednisone are a common example. Steroid injections can sometimes do this as well. These medications can be very useful and sometimes necessary, but they may make glucose harder to control for a period of time. If you recently started a steroid or received a steroid injection and your morning numbers are rising, tell your diabetes care team. Do not stop prescribed medication on your own, but do report the pattern. Now, let's make this practical. For the next 7 days, I want you to become a detective, not a judge. Do not write down bad number or I failed. Write down clues. Before bed, write your blood sugar if you check it. Write what you ate for dinner and what time you ate. Write whether the meal had protein and fiber, or whether it was mostly toast, rice, noodles, crackers, cereal, fruit, or sweets. Write whether you walked after dinner, even for 10 minutes. Write your medication time. Then write a few words about sleep, pain, bathroom trips, nightmares, sweating, snoring, stress, illness, or waking often. In the morning, check before food or coffee if that is part of your usual plan, and write the number down. After several days, you may begin to see the story. Maybe your sugar is higher after a very small dinner that is mostly carbohydrate. Maybe it is higher after poor sleep. Maybe it is higher after skipping dinner. Maybe it rises no matter what you eat, which may point more toward dawn phenomenon or medication timing. Or maybe there are signs that you could be going low overnight. This kind of record helps your doctor or pharmacist help you. It also helps you stop blaming yourself and start understanding your body. There are several safe steps that often make sense, depending on your situation. First, do not skip dinner just to chase a lower fasting number. Skipping can backfire, especially if you take medication that can cause low blood sugar. Second, make dinner balanced rather than tiny. A small dinner can be fine, but it should not be only starch. Third, be careful with large bedtime snacks unless your clinician has specifically recommended one. A bowl of cereal, sweet biscuits, juice, or a large fruit serving late at night can raise glucose for some people. Fourth, if it is safe for your balance, feet, heart, and joints, consider gentle movement after dinner. This does not have to be a hard workout. Even a slow walk around the house, down the hallway, or around the block can help muscles use glucose. If you take insulin or medication that can cause lows, ask your care team how to move safely and when you should check your sugar. Fifth, protect sleep as part of your diabetes care. Reduce late caffeine, manage pain, keep a regular bedtime when possible, and ask about sleep apnea if the signs fit. Sixth, review medication timing with your doctor or pharmacist. Bring your 7-day log and ask clear questions. Could this be dawn phenomenon? Could my medication be wearing off? Could I be going low overnight? Could my dinner be too small or unbalanced? Those are strong, useful questions. They are much better than quietly suffering, eating less and less, or changing medication without guidance. I also want to mention what you do after you see a high morning number. Many people respond by skipping breakfast. I understand the thinking. They say, "My sugar is already high, so I should not eat." But for some older adults, skipping breakfast can make the rest of the day more unstable. You may become weak, lightheaded, or overly hungry later. You may overeat at lunch. You may take medication without enough food. And your liver may continue releasing glucose because your body still thinks it needs fuel. A steadier breakfast is usually better than no plan at all. That might be eggs with vegetables, plain yogurt with nuts and berries, oatmeal with added protein and chia, tofu with greens, or a small piece of whole grain toast with peanut butter. What you want to avoid is starting the day with juice, jam, sweet cereal, or pastries, because those can raise glucose quickly. Also, remember to wash and dry your hands before checking your blood sugar. This sounds simple, but it matters. Fruit juice, food residue, lotion, or a little sugar on the fingers can give a falsely high reading. If a number surprises you, wash your hands, use a fresh strip if needed, and recheck before you panic. Now let's talk about when to call for help. Contact your healthcare professional if your fasting morning blood sugar is repeatedly above your personal target. Call if you have signs that may suggest nighttime low blood sugar, such as sweating, nightmares, shaking, confusion, morning headaches, or waking unusually weak. Call if your numbers rise after starting steroids or receiving a steroid injection. Call if you are sick, dehydrated, vomiting, feverish, or unable to eat normally. And seek urgent help if your blood sugar is very high and you have vomiting, severe weakness, confusion, deep breathing, abdominal pain, fruity smelling breath, or high ketones if you have been told to check ketones. If your blood sugar is low and you cannot treat it safely, or you faint, become confused, or have a seizure, that is an emergency. Please do not panic if your personal target is different from another person's. Many seniors have different goals. For many adults with diabetes, common targets may include a pre-meal blood sugar around 80 to 130 milligrams per deciliter, or 4.4 to 7.2 millimoles per liter, and a 2-hour after-meal reading under 180 milligrams per deciliter, or under 10 millimoles per liter. But a healthy 62-year-old may have different goals than an 87-year-old with kidney disease, memory changes, falls, or previous severe hypoglycemia. Your target should be personal, and your care team should help set it. Before I close, let me bring this together with 2 examples. One patient I will call Margaret was in her 70s and felt defeated. She had type 2 diabetes and kept waking with high morning readings, even though she had reduced dinner to tea and toast, or sometimes just a banana. She also had occasional morning headaches and damp night clothes, but she thought that was just aging. When her care team looked more closely, the concern was not that she needed to eat even less. The concern was that she might be dipping too low overnight and then rebounding high by morning. Her pattern needed careful review, not punishment. Another patient, Robert, had a different story. His bedtime number was reasonable, and his overnight number was not low, but by morning it climbed. That pattern looked more like dawn phenomenon. His care team reviewed medication timing, dinner balance, and gentle evening movement. The morning problem looked similar in both people, but the overnight cause was different. That is the key lesson. High morning blood sugar after a light dinner is not one single problem. It may be dawn phenomenon. It may be medication wearing off. It may be a rebound after a nighttime low. It may be a dinner that was small but mostly fast carbohydrate. It may be dehydration, poor sleep, pain, infection, steroid medication, or sleep apnea. So please do not hear this video as a reason to fear dinner. Hear it as a reason to understand your overnight pattern, If this explanation helped you feel less confused, subscribe to Dr. Claire Bennett for calm, practical senior health guidance, and keep a simple 7-day blood sugar log before your next medical appointment. That one small record may help you get a much clearer answer than guessing from one morning number. Tonight, do not punish yourself. Eat a steady dinner. Take your medication exactly as prescribed. Drink enough earlier in the day. Move gently after dinner if it is safe. Notice your sleep. And if the morning number is high again, write it down without shame. Your glucose meter is not judging you. It is giving you clues. And when you understand those clues, you can stop guessing, ask better questions, and begin building safer mornings. Not perfect mornings. Safer mornings, calmer mornings, and a body you understand a little better each day.